Okay.
I'll explain.
People. Okay.
Welcome, everyone. A few introductory comments here tonight. First of all, we're going to try to videotape this. One of my goals with this whole thing, you guys have heard before, is to try to get this to a broad audience, to as many people as I can. And I was flipping by the Richmond TV channel, and there's a couple of educational channels. And I saw some of the shows on there, and I thought, boy, why couldn't I get mine on there? So I called them up, and they said, sure, we can't film it for you, but if you give us the tape, we'll play it. So I'm going to try to film it myself and send them a DVD and see what happens, both Richmond and Connersville. So if we can get that shown over those channels, that's just a good start. So one thing I was worried about was if maybe people would be uncomfortable with the camera, but we're just going to keep the camera on me, not because I'm egotistical, but because I figured nobody wanted to be on the camera. So any questions that you ask, what I'll do is I'll repeat those so that everybody can hear them, first of all, but also for the microphone on the camera, because I don't think that thing will pick up you guys' voices out there very well. So please don't be spooked by it. It's just a camcorder, and it's going to be mainly on me. I guess introductions, probably most of you I recognize, so you've been here before, you've been here last year. My name is Dr. David Henley, I'm a psychiatrist, and the title of this talk is It's a Brain Thing, and it's a monthly, every third Tuesday of the month. It's about an hour long, and it's my attempt at trying to destigmatize not just mental illness, but also the brain in general. I mean, we all sort of take for granted our brains, and I want to try to convince folks that we shouldn't take it for granted, that it is real, that it does function in certain ways, and sometimes those pathways in the brain don't function like they should, and that leads to different pathologies or illnesses, which I call brain illnesses, which a lot of folks call mental illnesses, but there's a lot of stigma with the word mental illness, so I prefer brain illness. But this lecture is basically a different topic every month, and it's through the school year. Probably will take off in December because the third Tuesday is getting close to Christmas, and folks will probably not want to be here for that, and maybe me either. Both my kids' birthdays are around Christmas, so probably we'll take that month off. But outside of that, all the months all the way till May. The May will probably be the last one, and every month we'll do this, different topics. The end of last year, we did a little survey as to what folks might want to hear about, first, second, third, so on. And depression was number one, and dementia was the second one, and there was some other stuff that sort of tied for the third place. So this is why we're starting with depression tonight. So I guess we'll go ahead and get started. I titled this talk, Depression, What Tom Cruise Doesn't Know. And how many of you guys saw Tom Cruise or heard about that sort of those, I guess there were a couple of different things he did that were kind of bizarre on TV, and one was a interview with Matt Lauer where he went, and he's a member of the Church of Scientology, and certainly everybody's welcome to have their own opinions and everything, and so I would not take that away from him at all. But he kind of went on and he said maybe some irresponsible things about that there probably is no such thing as a chemical imbalance, and nobody needs medicine for illnesses of the brain and things like that, which really isn't based in science, although he made it sound like it was. And he also said some disparaging things about psychiatry, and so there was a lot of media hype about that, of course. And some people think he did it just to try to get the ratings of his new movie, War of the Worlds, up there, and it probably worked. But tonight what I'll try to do is answer some of those questions. I mean, why do we care about depression? Is it a real illness? What causes it? How do you treat it? Some of these kind of things. And I want to make this kind of interactive, so folks, feel free to interrupt me, and if you have a question about anything, because sometimes I just get rolling and I'll bore you to death, and I'll have all these nodding heads out there. Everybody start to drift off, especially as warm as it is. So, any questions at all, feel free to ask in the middle of the talk. I don't care. First thing I wanted to start with is why do we care about depression? Is it something that the common person should worry about or will come in contact with, or will it affect the common person? Well, the answer is yes. In the adult population, in any given year, about 10% of patients, listen to me talking like a doctor, of people in the United States population, adults this is, about 10% of them will have depression. That's about 19 million people, guys. It's a lot of people. So it affects a lot of people, and that's just 19 million people that have it. That's not counting all the folks that are affected by it from either work, from families, things like that. So it's something we should all be concerned about and kind of aware of. And there is mortality associated with depression. Does anybody know, what's dangerous about depression? Does anybody know? Can you die from it? Suicide, right answer, correct. She didn't even have to ask the audience. She knew that one right away. Yeah, suicide is ultimately the scariest thing, or the most severe thing that can happen from depression, and that's usually after months of suffering that the person goes through before they get to that point. So for all those reasons, we care about depression, and this is why we want to talk about it tonight. There's a lot of misconceptions. A lot of folks think it's a weakness. How many times have you ever heard somebody say to somebody else, "Oh, come on, pull yourself up by your bootstraps. You can do it. It's okay. You're going to get through this." It's almost like it's a weakness of character or something. It's a character flaw, the depression is. Well, it's not. That's not what it is at all. I mean, obviously, nobody chooses to have depression, and if it was that easy, all of us, you wouldn't need any treatment. You wouldn't need any medicines. You wouldn't need any psychiatrists. You wouldn't need Tom Cruise and the Church of Scientology. You wouldn't need any of that. You just pull yourself up by your bootstraps and go along. But that doesn't happen. It's not that easy. So, what is depression? Is it just a blue mood? Does anybody know? That's part of it. Yeah, I mean, you get a down mood, you get sort of sad. But all of us get sad, right? I mean, how many in here have ever felt sad? I mean, all of us. It's a human emotion, okay? Our brain has the ability to feel emotion. So we feel happy, we feel sad, we feel different things. Anger, irritability, it's normal, okay? It's normal if it's passing. If you get angry about something and then you get over it. If you get sad about something and then you get over it, that's fairly normal stuff. That's common stuff. It's part of being human. But on the other hand, if you're sad and it clusters together with a lot of other symptoms, which we're going to go into in a second, and it interferes with your function day to day, and it lasts for a long time, almost every day, that's not normal. That's not good. That's a problem, and that could lead to outcomes such as suicide and things. So depression affects the way you think, it affects the way you feel, it affects all your bodily processes. We'll talk about that in a minute. I mean, the brain's the master control center. So if it's not working like it should, you're going to feel more pain. You're going to have problems with your bowels. You may have aches and pains all over. Your sleep cycle is going to be all out of whack. So there's a whole bunch of stuff in your body that's affected by the depression. So it's an illness of the brain, or a malfunction of some of the pathways in the brain is really a more technical way to put it, that leads to a cluster of symptoms that fall together. And remember, in psychiatry, we don't have great ways of diagnosing stuff. The science just isn't there yet for us to put you in a scanner, scan your brain, and say, here's a picture of your brain, and that's how we know it's depression. Here's a normal brain without depression. Here's a brain with depression. We don't have the ability we can see some differences, but we don't see enough that we can diagnose depression that way, or with a blood test or anything like that. So we have to go with symptoms, things that kind of cluster together that tell us something's not right, and that something is depression. So major depression is the technical term, or clinical depression is another word for it. But major depression is what we refer to, was what I'm referring to tonight. It's the illness, the brain illness. It's more than just a passing blue mood. Basically, you have to have at least 2 weeks. Usually it's longer. By the time somebody sees me or their doctor, typically it's been going on for several months. It kicks in slow. It's kind of gradual. You kind of wake up feeling kind of grouchy, not in such a good mood, and day doesn't go so well, and it just keeps getting worse. As days go on, you have more and more bad days, less and less good days, and you get kind of slowly sink into this depression, okay? So it's usually more than 2 weeks, but it has to be at least 2 weeks. So that sort of takes away the having a bad day thing, okay? You have to have a depressed or irritable mood more days than not every single day, over and over again for these weeks or months, okay? So it's not that you'll never feel good. You might have some good moments or good times, but not very much, and they get less and less and less the more this process goes on in your brain. So once you get really depressed, sometimes it's very hard to have any good moments. I mean, you may not feel good at all. You may just feel depressed all the time. But the depressed or irritable mood, remember the irritable part, because a lot of, like men, for instance, they won't come into the doctor saying I'm depressed or tearful or anything like that. They'll be irritable. And the spouse comes in, and that's how you know they're depressed. Because the wife comes in and says, he's irritable. Okay? And that's not his normal self. I mean, yeah, of course, everybody has some irritability, but now he's irritable every day, all the time, over and over again. Another thing that occurs that goes with these other symptoms is a loss of interest. Folks start to lose interest in things that they normally enjoyed. Most folks have some kind of hobby or something they enjoy doing, whether it's going out to the shopping center, going out to eat, whether it's woodworking or different things, Whatever your hobby is, if it starts falling away and you're having these other symptoms too, really these two things are kind of critical. I mean, really without any of the other symptoms, you can almost wonder if it's 2 weeks or more and you're having these things pretty bad almost every day, that's a pretty good sign that you're depressed. So just with those two things, the loss of interest and the depressed or irritable mood. But also you typically have sleep changes. So your sleep pattern starts to get messed up on you. Sometimes you wake up in the middle of the night and you can't go back to sleep again for a couple of hours. And then you go to sleep and then you sleep till noon the next day. And then sort of 2 or 3 in the afternoon you're kind of just worn out, exhausted, fatigued, and so your sleep cycle starts to get all out of whack. So that's another symptom. Okay, energy changes. Now, interestingly enough, I put changes. Sleep changes, energy changes, appetite changes. By that I mean you can either have an increase in those things or a decrease in those things. And it's just, the fact is that it's different than your normal pattern. So you can, most people I would say don't sleep as well, and their energy level drops, and their appetite usually drops too for depression. But that's not everybody. Some people their appetite goes up. Some people they get more kind of agitated, or their energy levels is a little too much. Guilt or worthless feelings. Again, a lot of the time. All of us feel guilty sometimes. All of us may feel worthless at sometimes too. But if you start feeling guilty and worthless every day, most often, for weeks or months at a time, that's not so good. Something's wrong. And typically, in my experience, these folks can't get that out of their head. So it's like they just, they ruminate on something that happened years ago. I should have done this, or I shouldn't have done that, or I should have said this to this person, or they beat themselves up over stuff that happened a long time ago, and they can't get it out of their head. So that's real common. Concentration problems. Remember a long time ago we talked about a part of your brain that's involved in concentration and memory shrinking when it gets depressed for so long. That's probably because of this. That's probably what causes this, that part of the brain shrinking on you. Finally, imagine now you've got somebody who's got all these other symptoms that's going on for weeks at a time, and they're starting to just feel, everything, with depression, everything is negative. You're not doing any good in the world, really, when you're feeling depressed. You feel like everybody else would be better off without you, and sometimes you get to the point where I don't care if I wake up anymore, or even the next step is I might as well take myself out of this world and put myself and everyone else out of our misery. And that's where the suicide comes in. So it's not typically just all of a sudden you get suicidal and kill yourself. It's usually that you see some of this stuff coming first. And this is really important for families, for loved ones. If somebody says to you, I don't care if I wake up anymore, you've got to get them to the doctor quick, because that's a pretty bad depression. That's getting pretty bad, and it's one step away from them saying, I just think I better check out and get it over with, and doing it themselves. So that's a pretty risky thing. Questions about all those symptoms so far. Does that stuff make sense? Has anybody ever known anybody or seen anybody like that before? Probably most of you have seen somebody like that. Anybody have questions about the symptoms or anything that you want to point out that I missed? Sometimes there's things that I overlook too. Okay. Some of the other, and I mentioned already that this stuff interferes with your function. So as you can imagine, if your energy level's not good and you can't concentrate, you're not going to do well on the job. You're going to start missing days because your sleep cycle's all out of whack. So it's going to interfere a lot with your job, with school, with your relationships because of the irritability and some other stuff. And then also wanted to mention the physical symptoms. I talked a second about that, about pain. Think about pain for a second. What part of your body tells you how bad your pain is? You guys know? It's a brain thing, so it's the brain, right? Usually when I ask those kind of questions, just to give you a hint, usually it's the brain. But yeah, it's your brain. I mean, your body tells you there's something wrong. So if you fracture your leg, your lower leg, let's say you're running along and bam, you hit that on something, you fracture it, okay? There's a signal that's sent up to your brain, but it's just a signal saying it's bad. Something bad is happening in the leg. And it's your body's way of saying, take care of this thing, do something about it. If you keep running on it, you're going to completely destroy it and permanently damage it. So it tells you, it sends you that signal. Your brain's the one that is the thing then that picks it up and says, how bad is it? Well, if you poked yourself with a thorn or something like that, that's a little different signal than if you just broke your leg, right? Probably anybody that's broken a bone knows that it's different than if you just get a little cut or a bruise or something, correct? That's your brain telling you that, okay? If you're depressed, there's problems in your brain. It's not working like it should. So your ability to interpret pain is not the same. You're going to interpret pain worse. So pain, what normally would be a 2 out of 10 pain, let's say, 10 being like the worst pain ever, 0 being no pain at all. If you have a 2 out of 10 pain, and then you get depressed, it might be a 5 or 6 or 7 out of 10. So pain is something that goes along with depression a lot. How many folks have heard of irritable bowel syndrome? Okay. Many people that have depression and anxiety symptoms end up with GI distress of some kind. That could be irritable bowel syndrome, which presents in different ways. So a lot of people think of irritable bowels just as diarrhea, but it can also be constipation and stuff like that. But the bowels are, for some reason, very tied into the brain. And a lot of the older folks that I see with depression, they never even come in talking about depression. They come in with complaints of GI problems. One guy, well, I'll tell you the story in a minute, but one guy went up to Mayo to get worked up for this. And it was depression the whole time. Multi-million-dollar workup, depression. Once we treated the depression, he was eating fine, he gained his weight back, and the appetite and the nausea that he had was gone. Or the appetite was better and the nausea was gone. So, what causes depression? Does anybody have any ideas? I mean, the science isn't fully there yet, but we have a lot. We're getting there. We're getting there a lot better than we used to. You guys know, for sure you know, I'm sure you've heard of it running in families. So genetically, there's got to be something genetic there. We're actually getting to the point where we can find now some genetic differences in people that puts them more at risk for depression. And here's the fascinating thing. I love the fascinating stuff. I say that word a lot. They have done a study where they've shown that there's a certain genetic makeup that people have, okay, that if you expose them to stress, now remember I'm saying expose them to stress, so that's an environmental thing. It has to be something from the outside coming down onto that individual, that they're more likely to get depressed than somebody who doesn't have that particular genetic makeup. So you take, give you an example, the way they did this in animals, they did it in humans. But they did it in humans, and they looked to see how common it was for folks who had child abuse to get depressed if they had this genetic makeup and if they didn't. Ones that had the genetic makeup that put them at risk for depression and they had the child abuse, after the age of 18, 63% had depression. The folks that didn't have that genetic makeup but had the same abuse, 30%. It's twice as high. So there's a difference in the genetic makeup of the one group with the 63% incidence of depression. So that shows you that, and certainly if it's genetic, it could be inherited. So it takes both, though. If you looked at both of those groups and they didn't get stressed, they have exactly the same incidence of depression. So without the stress, they look the same. You couldn't tell. Well, with the stress, there's a big difference, twice as much depression. So that's just a sort of a surface little description of what we're starting to find out now about some of the genetic stuff. Obviously, the environment we just talked about, the environment can also cause depression. Chronic stress tends to do that. Acute stress, most of us can handle. Our bodies are made for that. We're kind of geared up to handle a hungry lion standing in front of us, or to handle one bad day at work or something. But ongoing, chronic stress, whether that's poverty, whether that's Hurricane Katrina coming through, wiping out everything you have, and now you're just completely homeless, have nowhere to go, that's a pretty chronic stressor. That's going to go on for months for these people. There's going to be a lot of depression coming out of that. Any of us, if you stress us enough, any of us, I don't care what our genetic makeup is, there's a big chance we're going to get depressed. So stress in the environment is incredibly important. Interestingly enough, there are some So, neurologic illnesses that we all think of as neurologic, which they are, like Alzheimer's disease, Parkinson's disease, stroke, and multiple sclerosis. These type of illnesses damage brain cells, okay? All in different, parts of the brain or in different ways. But when you damage nerve cells or brain cells, there's depression that goes with that. All of those illnesses have a certain degree of depression. MS, interestingly enough, has the highest. 60% of MS patients, multiple sclerosis patients, get depression. We have done studies to show that that is not just because the person finds out they have MS. A lot of these people, before they even know they have the illness, they get depressed. It's from the damage to the brain cells is what's causing that. So that's another cause. Female hormone imbalances is another cause of depression. Thyroid problems, if your thyroid is low, that can cause depression. Especially in the older people who don't eat real well, things like folate and vitamin B12 deficiencies, those can cause depression. And what am I missing? I think I pretty much covered it. Anybody think of anything else that I missed? Does it all sound reasonable? Have you guys heard of some of that stuff before? Okay. So with all these different things that can cause it, obviously you got to realize that the more of those things you have, like if you have a genetic makeup for depression, or puts you at higher risk for depression, plus a stressor, plus then on top of that you have a stroke or something like that. I mean, that's the highest risk person right there. Now, any questions about any of that stuff so far? Okay, let's talk for a second about how does depression look in different subsets of the population, okay? So in men and women, how does it look differently? I sort of alluded to the fact that men don't come into the doctor's office and say, and break in tears and say, "Doc, I'm depressed." They don't do that. Why? I mean, it's not because they don't feel like doing it, I'm sure. And I have had guys in my office cry, and Mr. Rogers can attest to the same thing. But it's our society, I think. I think our society says it's not kosher for a guy to cry. You just don't do that kind of stuff. Women, it's okay, but for men, it's not. That's all our society. But in any case, men come in and they complain of something else. It's physical or it's an anxiety symptom, but it's not depression. Until you get, again, the spouse in there and they tell you the truth. But interestingly enough, women, before menopause, before they go through menopause, you guys know what menopause is, right? Women, for sure, know what menopause is. Do the men in the room know what menopause is? Where the female hormones start to cycle, the ovaries start to sputter, and so they put out a little bit of female hormone, estrogen and stuff. But then as the woman gets older, usually around the age of 50, these hormones start to diminish. Okay, there's not as much of them. Before the age of 50, then on average, women have a 2 times higher risk of depression than men. Now we don't know why that is. Is it because they live a more stressful life? Women would probably say yes. And, there's a lot to that, especially historically. But it's probably not just that. If you think about it, any time a woman's hormones change dramatically, there's a higher risk for depression. Premenstrually, every month before menstruation, sometimes women will get depressed. There's a certain subset of women who get depressed with that. Postpartum, after a baby is born, there's dramatic change in female hormones at that point. And a lot of women, you've heard about Brooke Shields. She had, and I guess she was the one that went back and forth with Tom Cruise about whether there's a real thing. And let me tell you, there is a real thing. She's right, there is. And it's not the stress of the childbirth. It's not just that. That probably adds to it. That's the stressor. But there's something else too. It's probably the hormones. And then around the time that the woman's going through menopause is a higher risk period. But after the age of menopause, equal incidence of depression between men and women. Kind of neat, huh? Kind of interesting. It's got to have something to do with hormones, at least in my head. That's the only thing that could be. When it comes to suicidal things, women are more likely to attempt suicide, so they do it more often. Men are more likely to actually commit suicide and kill themselves. And the reason being is because men tend to be more violent in general. So when they try to attempt suicide, they do it by running a car into a tree, or shooting themselves, or hanging themselves. I mean, it's a violent manner. Women, overdosing and cutting on their wrists or cutting on themselves in some way is the number one way that the top couple of things that they do to attempt suicide. And so typically the men have more lethal methods. That's nothing to be proud of, men. Okay? That's not such a good thing. So those are some sort of differences between men and women, but now what about different populations? So like children versus elderly. I sort of alluded to the fact that elderly kind of present with depression, not so much, again, with the tears and with depression, saying I'm depressed and things like that, but they certainly will have a lot of physical problems. The gentleman I talked about, I can give you a little story about this one, and it's nobody from around here, so I'm not betraying any confidentiality, but this gentleman had a lot of GI problems. So he lost 53 pounds in 4 weeks, and what happened was he had a lot of pain. He had some ruptured discs in his back, tons and tons of pain, couldn't seem to get any relief from the pain, slipped into a depression, lost 53 pounds, and of course the doctor was concerned, put him in the hospital, and did a whole bunch of workup, looking at his GI tract, thinking, is there cancer? You know, what's going on? Couldn't find anything. Finally referred him to Mayo. They admitted him to the hospital with that degree of weight loss too. And they did a big workup. They couldn't find anything. Finally, somebody thought, maybe we should call a psychiatrist. Maybe he's depressed. Comes in, he's depressed. Put him on medicines. He starts to gain his weight back. He starts to eat again. The GI symptoms go away, and now he's not depressed anymore, and he's doing fine. So depression, I mean, don't let it fool you. If you have an elderly family member and they're not eating and they're not sleeping and they're complaining over and over about something, lump in their throat, can't swallow, can't eat, bowels aren't working, whatever it is, those are the classic ones. I've seen that over and over again. Those things could be depression, probably are depression. And not that you shouldn't work up the other stuff. So certainly if you need to, if the doctor says let's go ahead and do a scope and look in the belly, let's do a scope, look in the colon, whatever he says, you go ahead and do that. But if that stuff's all normal, you've got to think about depression, guys. Got to. You don't want to miss that. Children, they also don't tend to present with these classic type symptoms. I mean, they don't come in usually crying and saying I'm depressed. What will they do? Younger kids cling to their parents. They don't want to leave their parents' side. They refuse to go to school. They may feign illness of some kind, or even have like these GI symptoms and headaches and things like that I was talking about. Sometimes they get fearful their parents will die, and it's borders on almost a psychotic fear of that. You know, there's no real reason that they would think it, but in their head they can't get it out of their mind. You know that their parents may die. The older kids, though, they start to act out at school. You know, they'll be more angry, more irritable. They'll get in fights. Of course, they won't be able to concentrate very well at school. A lot of trouble with relationships with other kids. That's where the fights come from and all that. So these are some of the differences between the different populations and how they might present with depression. Does any of that stuff sound familiar? The teachers in the room and the parents in the room, have you seen kids like that ever? Have you ever seen a kid that got referred to somebody for treatment and then came back after treatment? Did they look any different?
I have a question on that.
Absolutely.
I had